Good afternoon, everyone. And hello, I am Sheila McLean, Vice President with the Health Quality Innovation Network, or HQUIN. And I think I know many of you, and we're excited that you're going to spend the next 30 minutes with you. And welcome to the first session of our office hours series addressing quality improvement principles for your infection control and prevention program. Just a few housekeeping items to get us started briefly. Everyone is currently muted and in listen-only mode. So if you have any questions or want to make a comment, please use the Q&A icon at the bottom of your screen. And all attendees will be able to see the questions and responses. And if for some reason we're unable to answer all of the questions during the session, we'll certainly follow up afterwards. Also, if you'd like to ask a question live, click the raise your hand button and we will unmute you so that you can either ask a question or make a comment over the audio line. We are also going to post a short evaluation at the end. We'll be posting that at the end and in chat. We'd appreciate you taking a few minutes to complete the evaluation so that we can better, serve you in the future and meet your needs. And lastly, from a housekeeping standpoint, if you encounter audio challenges, click your audio settings at the bottom of the left-hand corner of your screen, and your listen by telephone options, they were provided in your confirmation email. So I am joined today by Mary Childs, who is president and owner of Childs Healthcare Consulting. Mary is a registered nurse, a RAC certified nurse, as well as a QAPI certified professional. She supports facilities across the U.S. to implement systems that will enhance compliance with regulatory requirements and improve outcomes. And I'm also joined by our HQUIN team of infection preventionists and quality improvement advisors. Mary and I are going to provide a brief overview or an instruction to this presentation, which is really meant to serve as a visual resource companion to the CMS QAPI guidance for performing root cause analysis, or RCA. And while we know RCA is a key principle of the quality improvement process, we are currently seeing RCAs being required as part of the Infection Control Directed Plans of Corrections, or DPOCs. So we thought this could be a helpful tool not only in your QAPI program, but in survey readiness and survey response. To access this and the other resources as part of our sessions, your facility will need to be a member of the HQUIN network. So if you're not a member, to do so, please simply email your state's quality improvement advisor that we're going to have listed at the end of this presentation. And those facilities that are HQUIN members will automatically be sent the resources. As part of the facility's QAPI process, and now the DPOC process, a root cause analysis is to be conducted as a method for identifying contributing causal factors that underlie variation in performance. And you can see here on the slide that we've provided a link to the complete QAPI at a glance guide for your reference. As we move through the RCA process, it's important to remember that you need to thoroughly explore the problem at issue. We know there are often multiple contributing factors, and here we've provided you a direct link to the QAPI RCA guide. So now I'm going to turn it over to Mary to walk us through the 7 steps of an RCA. Mary, it's all yours.
Okay, thank you so much, Sheila. I appreciate the opportunity of being with the team today, and I'm going to provide some definite highlights of the 7 steps. So let's start with step 1. And this is really important. We really need to identify the event that is to be investigated and to begin to gather preliminary information. Now, one of the important things is recognizing when there's an opportunity. There are 3 main focus reasons for developing an RCA, but there may be others. So the first one has to do with opportunity for improvement. This is where you self-identify. There's an opportunity to be more effective, to change outcomes, to reduce the frequency of something, to improve frequency. It doesn't mean that you're doing anything wrong. It's just things better. The second one would occur oftentimes when there has been an adverse outcome. Think about those adverse outcomes that we hear of all the time. Someone has developed a pressure injury. Someone has had a fall that resulted in a major injury. We had a major medication administration error. These are things that happen, those unfortunate things that happen, that we want to make sure that we put systems in place to prevent from occurring again. And as Sheila mentioned, as part of the CMS enhanced enforcement, we now have specific directions to look at the frequency of citation at tag F880, which is our infection control tag. And as part of doing the enhanced enforcement, facilities are being required based upon scope and severity and frequency of citations at that tag to develop a root cause analysis and subsequently to develop a directed plan of correction. So Sheila, let's move to step 2, please. In step 2, this is really important. The organization needs to charter and select a team that is going to work on this project. Now, as part of the facility leadership, we should provide a charter. A charter is a means for recognizing the importance, the urgency, and for creating the team and creating a general objective. The facility will establish someone to be designated as the facilitator of that team and will also select individuals to participate in the team. And those individuals should not all be leadership members. You really want to get the end users of the system or the process. You'll also see on this slide that we've given you a link to the QAPI worksheet to create performance improvement project charter. So as we begin to move forward, and we now have a charter, we now have a mission, we need to go to step 3. In step 3, we're beginning to describe what really happened at whatever drove the reason for this root cause analysis. So we want to look at what, when, where, who, and why. And as we can see on the next slide, which leads us to step 4, it's not just a matter of collecting that, but it's a matter of beginning to identify the contributing factors, looking at things categorically. And we've given you a couple of examples of categories of things that you may want to explore. In looking at management factors, you might consider, did the leadership style have an impact upon this? Is this based upon the way that people understand our policies and our protocols, or the lack thereof? When we look at organizational factors, look at things such as budget, staffing patterns, but also perhaps even look to see whether or not the mission and the value statements, the philosophy of this particular organization plays into any of the contributing factors. We certainly want to look at human resource factors. This might include things such as looking at assignments and scheduling. It may include looking at benefits, pay rates, etc. And it certainly could look at your attendance, whether or not someone has called out for a particular day. Now, the last one that I want to talk about a little bit in detail is looking at those individual factors. When you identify the people that have been involved in the situation that you were trying to correct and or prevent from occurring again, you need to look at what was that individual's perception? What was going on for that individual? Did that individual have a personal belief? How is it affected by stress and anxiety? Just think about the situations that we're living in today, the longevity of this pandemic, and that we really don't have a clue, and it's beginning to wear on all of us. You see that there is one other arrow pointing, and it talks about other factors. This kind of goes back a little bit to that who or any other types of miscellaneous issues. But you do want to look to see whether or not this involves staff, whether it involved visitors, whether perhaps it involved one of your consultants or your vendors. So as we look at the next slide, we've provided you with some helpful hints. Now, further explanation of all of these helpful hints are found in the resources that HQIN has provided to you in these links. But one of the things that I find particularly helpful is let's create a timeline. Let's look at things in a sequential and chronological manner. This occurred at this point, and then this happened, and then this happened. Now, I tend to be a very visual person, so sometimes as I begin to do this, I use flow charts, or I use flip charts, or I use little Post-it notes, or I simply doodle on a pad, but it helps me to begin to get things in a chronological and sequential order. The other thing is helpful hint number 2. It's about brainstorming, where you want to be sure that you consider all possibilities. Remember that caution that Sheila gave you very early in the introduction. If you're going in as you begin this process with the thought that you already know what to do, that you know everything about it, then we're not taking advantage and really doing a root cause. That kind of leads us to the third helpful hint, avoiding hindsight bias. So what does hindsight bias really mean? It means that as time evolves, we begin to paint a little different picture. We learn a tidbit, here a tidbit, there another tidbit, and we begin to formulate things. But what we really have to do is structure ourselves so that we tend to focus directly on what was the information known at the time of the identified opportunity. And sometimes that's a little hard to do. So let's move to step number 5. And step number 5 is where we're really going to start to dig down and to identify the root causes. So let's look at step number 1. What actually occurred at this opportunity? Looking at when did this occur? Can we associate it with a specific task or a shift or a time of day? Looking at where did it occur? Did it occur within your building? Did it occur within a special unit? Perhaps within a specific resident room? Or did it occur with a task again, not just when, but associated with something like MedPass or providing care for somebody that is COVID positive? We talked a little bit about looking at who was involved, okay? Looking at specific persons involved so that we can begin to build and see whether or not there are any trends or patterns. And then last but not least, we begin to explore the why. Part of this that you want to look at is if you've already have an established policy or plan or protocol, or you have given direction previously, part of this why is, why wasn't that followed? These are all contributing factors, but also remember that human perspective. Now, there's lots of models for looking at root cause analysis. One of the simplest models is the 5 whys, okay? The 5 whys model is a model that we often use inadvertently throughout the day without really understanding that we have done this. So as we move to the next slide, we're going to see that the 5 whys can be particularly helpful when there are human factors or interactions. These are things because it's important for long-term care. We deal with humans every day, whether it's our residents, whether it's our staff, whether it's our vendors, whether it's visitors or family members, but that's part of our business. So it's important to choose a system that is very user-friendly and lends itself. The 5 whys is also good for when we look at environmental or systemic factors, okay? Looking at things to look at why something did not work. And then it's also a very useful tool in looking at day-to-day provision of care and services that we oftentimes use, again, perhaps not even realizing it, before an incident actually occurs. So as we explore the nature of the business of long-term care, the nature of taking care of residents, the nature of nurturing our staff, the nature of interacting in positive ways with families and other vendors, it's important to make sure that we choose a model that takes those things into account. Now, at the bottom of this particular screen, you will see that we have given you the CMS QAPI 5 whys tool for root cause analysis.
And Mary, I'm going to share another tool just to show them that ties in with the CMS QAPI 5 whys. In addition to this presentation being a complement to that analysis, we also have created a 5 whys worksheet. So this is just to briefly show you that this is also a companion tool that goes with this presentation, and you can see it just helps you really think out your reasons or the root cause using the 5 whys as you work through that. So thank you. I just wanted to share that as well, Mary.
Thank you, Sheila. And if we can move to the next slide, this is one that is very timely for us. And this is an example of how the 5 whys can really work. So the situation had to do that the CNA was observed using vital sign machines between resident care without sanitizing them. So that's the opportunity that was identified. So then we begin to ask our first why. And why was she doing that? So we get our first answer, that there were no sanitizing wipes available in the resident room. Well, now that we have that answer, we need to say, well, why did that occur? So the answer for that was that sanitizing wipes are kept in the supply closet and they were out of stock. Well, why did that occur? Because the staff was rushing that morning as one CNA had called in sick. Now, we all deal with this almost on a daily basis. So why? What we found out was that the supply clerk had not been notified that there was a lack of wipes. Why? And as we finally get down to our last why, we realize that we really did not have a system or a process. So now that we know the why for this, we now get to go to step number 6. Step number 6 is critical because this is where we actually design and implement a change that is going to reduce and or eliminate the potential of this happening again in the future. Now, the team needs to be determining this. So as you see, there were multiple people involved in this process as we began to identify them during the 5 whys. So one of the things that we have to do is focus not just on correcting it for that day, but to focus on putting systemic processes or systems in place that is going to minimize the likelihood of this occurring again or of there being a similar type of event. Each of your causative factors needs to have an action plan. And let me just stress that word because that is a verb. Action plan means that you are required to do something. So in this particular example, an example of an action plan would be that we could mount the holder for the sanitizing wipes directly on the sign machine. If we use the previous example, then we also have to look at how can we communicate, what is our system for communicating to the supply clerk when something needs to be filled. So Sheila, let's go to the next slide if we will. So as we begin to develop our plan, we also want to take the opportunity to provide certain questions to ourselves. Now, I'm not going to read all of these questions, but the first one says, what safeguards are needed to prevent this root cause from happening again or from it happening in a similar situation? What were the contributing factors that triggered this, and how have I addressed those in my plan? What we really want to know is how can I make it easy for staff or whomever, not just staff, but whomever. So it could be your consultant, again, your vendor. How can I make it easy for this visitor to be compliant with what we expect them to do? As we begin to look at those interventions, you'll see on the next slide that some interventions are stronger than others. So let's look at a couple of the weak ones because I think some of these may surprise you. Look at the one that talks about new procedure, or we simply sent out a memorandum and we told everybody what they were supposed to do. One of the key examples I have that just came about as a focus survey in Virginia was that the visitor who was there for an end-of-life visit took her mask and her gloves off. And as the team began to explore, they realized that the sign they had posted was too verbose. It had too much information. So people just passed it by thinking that they knew about it. Simply doing training after training is considered one of the weakest. We really need to go back and explore our methods for training and figure out what is the most productive. You'll see that we've given several examples of some intermediate steps. One example of an intermediate is looking to see whether or not we can utilize some software. So if we use the example of the 5 whys, how can we have software that helps to track our uses? But let's take a quick look at some of the strongest ones. Simplifying the task, breaking it down to make sure that people not only understand what they are supposed to do, but why. If you find yourself adding layer upon layer to a system, then we have missed that opportunity to make something that is going to be sustainable. So Sheila, if we could go to step 7. We have to measure the outcome of our changes. Are they achieving the goals that we want? Are we getting the expected outcomes? And as we look at the last slide for this part of the presentation, we can ask ourselves 3 questions. Did the recommendation or the corrective action plans actually get done? Have I trained everybody? Is there understanding? Are the signs put in place? Second question, are people complying with the facility policy and action plans? And if not, then why are they not complying? And last but not least, have the changes made a difference? Are you achieving the anticipated outcome? Was it worth the effort of what the team has put into place? So Sheila, that's a summary of the information that is provided in the multiple resources, and I'm going to turn it back over to you.
Thank you, Mary. So at this time, we have a few minutes. If anyone has a question, you're welcome to put your question in the Q&A box, or if you'd like to raise your hand to make either ask a question or make a comment. I would like to know, I know many of you all on this, actually everybody on this, has, gone through a root cause analysis, and I'm sure you're seeing various levels of that activity these days. Is there any best practices or any of the steps that maybe we've reviewed or helpful tips that we've reviewed today that you've kind of built upon and would say is a best practice as you've learned more and more and conducted more and more root cause analysis? Remember, I said I know many of you all that joined us today, so I see someone raise their hand. I was going to say I was going to volunteer, tell someone. So actually, if you guys can open the line for Pam Dozier, please.
Pam, this is Amy Lenz. You should be able to speak now.
Okay. We did a root cause analysis very recently based upon our directed plan of correction. And one of the things that we found to really make it flow better was to use the flip chart, because then it was very visual for the whole team, and we were back and add things as we started thinking about more things, and it was very, very visual and very helpful. And then we took that information and put it into the directed plan of correction.
Great, thank you.
And hi, Sheila, this is Joanne. We have one question for probably Mary. It has to do with the DPOC. The question is, after in the involvement with the RCA, who is considered the governing body that's involved in the RCA in a DPOC?
A great question, thank you. So the governing body at each facility may be a little bit different. You already, within the structure of your organization, have identified the governing body. In some cases, the governing body may be a corporate representatives or a series of representatives. In some cases, it may actually be a board of directors. In others, it might be a county commission that has been created to run. If you are part of a health system, it could be the hospital board of directors. So a lot has to do with how your organization is laid out. It is not just the facility leadership team. If you are a private owner, then more than likely you have created some type of governing body, a small board of directors.
Thank you, Mary. And
Thank you, Mary.
thank you, and thank you, Joanne. We are right at 2:30, and I do have to apologize. I did see a chat, I'm sorry, a question from Melissa, and who was the QIO for Illinois. And I went to try to type in my answer, and I accidentally lost that question. So bear with me, everybody. I'm going to give Melissa that name and number real quick. So for Illinois, it's Telegen, and the phone number is 1-800-383-2856. And Melissa, if you have any other questions or need assistance, just feel free to reach out to us and we'll help you get connected to Telegen. And sorry that I accidentally deleted your question. And I do see, I will So there is a question that I will close us with, and it says, are there resources or templates for RCA to submit for the DPOC? Mary, I might let you speak to that. I don't think there are any required templates, but I'll let you speak to that as to what maybe you're seeing from your experience.
So we have had communication with our state survey agency. There are no required formats. They do want to see the RCA and they want to be able to clearly see your identified causative factors and then correspond those factors to the action plans that you are doing. I do want to just very quickly remind everybody that pay attention to your letters if it's coming about as a survey, because we still have to write a plan of correction, and that plan of correction is submitted more often than not on the 2567 and through the EPOC or through some other means of getting it to your survey agency. That has a timeline of 10 days. Your DPOC, however, has a different timeline, and it does not get written on the 2567, but it can be an attachment into EPOC, or you can send it by other means to your state survey agency. And that DPOC has to include the RCA as well as your resulting action plan.
Right. Well, thank you, Mary, and thank you everyone for joining us today. I want to be respectful of the time that we've set. And if you think of questions as you review these resources or have time to digest this information, feel free to email us and we'll be happy to help or get you to the right people who can help. Please remember to complete the evaluation, and we also invite you to join us on July the 28th at 1 p.m. Central Time, 2 p.m. Eastern Time for infection prevention action plans. So thank you again and have a good rest of your day, and thank you all for everything you're doing to serve your residents and staff, and have a good day. Bye-bye.